Teeth grinding or clenching your jaw. Let's talk about bruxism and autism. Bruxism is when you grind your teeth or clench your jaw. It's common in people with autism, and here's why. For many, it's linked to sensory overload, stress, or even jaw tension. Sometimes it's a way to self-regulate or cope with overwhelming feelings. You might notice a sore jaw, headaches, or even worn-down teeth. It often happens during sleep, so it's easy to miss. Managing bruxism can be tricky. Here's some tips. Try a mouth guard at night to protect your teeth. Use sensory tools or fidget items to redirect attention. Practice stress-reducing techniques like deep breathing and speak to a dentist for more professional advice. Do you experience bruxism or know someone who does? Share your tips and let's help each other out.